You started Lexapro because you couldn't stop the depressed, hopeless feelings, the excessive worrying, the racing thoughts and sleepless nights. That feeling of your brain having 50 browsers all open at the same time. And it worked, sort of. The anxiety subsided, your mood improved, but 6 months later you realize you haven't laughed, really laughed in months. You feel numb, no motivation, zero libido, your focus is non-existent, and you're struggling at work. You think, is this just who I am now? Hi, I'm Dr. A, quadruple board-certified psychiatrist and lifestyle physician. Today I'm revealing what actually happens in your brain on Lexapro, why the side effects hit some people harder than others, and the one critical mistake that can make stopping this medication feel like absolute hell. By the end of this video, I'll show you something most doctors never explain, why Lexapro works differently as you get older, and what to do about it. 47-year-old Rachel was the VP at a tech company, 2 kids in college, aging mother with dementia. She had been holding it together for years, until she wasn't. The anxiety hit like a moving train, heart pounding, chest tightness, couldn't sleep, couldn't focus, snapping at her team over nothing. She was eventually diagnosed with generalized anxiety disorder. Her doctor prescribed Lexapro. Give it 6 weeks, he said. 8 weeks later, the anxiety was better, but she wasn't her normal self. As she put it, I feel like a robot version of myself. I'm functional, but I'm not me. She also talked about her complete lack of sexual desire, stating she was now having problems with her husband. Here's what's actually happening in your brain. Lexapro, also known as escitalopram, is an SSRI, selective serotonin reuptake inhibitor. Think of your brain cells like 2 people having a conversation across a narrow gap. One person throws a message, serotonin, across the gap. The other person catches it, message received. Normally, the first person reaches out and pulls some of that serotonin back to use again later. That's called reuptake. Lexapro blocks that reaching hand. It says no, leave the serotonin out there longer. More serotonin floating in the gap means better mood regulation, less anxiety, better sleep for some people. Serotonin also controls your entire emotional range. It regulates sexual function, appetite, gut motility, even pain perception. Unfortunately, these brain changes can also cause your joy to flatten, dull pleasure, and erase desire. This is why people on Lexapro say things like, I'm not sad anymore, but I'm not happy either. I'm just existing. But here's what almost no one talks about. Lexapro works differently depending on what else is happening in your body. If you're in your 20s or 30s with relatively stable hormones, good sleep, low inflammation, and decent stress management, Lexapro's effects may be different. But if you're in your 40s or 50s, your brain is operating in a completely different environment. Declining estrogen affects how your brain uses serotonin. Chronic stress changes your overall well-being. Poor sleep disrupts your brain's ability to clear out inflammatory waste. Lexapro is trying to fix a serotonin problem in a brain that's also dealing with hormone chaos, mitochondrial burnout, and a nervous system stuck in survival mode. It's like trying to fix a flat tire when the whole car is on fire. This is why some patients tell me, Lexapro worked great in my 30s, but now I don't feel any effects. Your brain changed, the medication didn't. Considering hormone therapy, micronutrient testing, medical-grade supplements, and techniques for nervous system regulation can make a huge difference. Now, before I tell you what happened with Rachel, let me address the side effects no one wants to talk about. Sexual dysfunction. Studies show that 40 to 70% of people on SSRIs experience some form of sexual side effects. Reduced desire, difficulty with arousal, delayed or absent orgasm. For men, this might mean erectile dysfunction or the inability to finish. For women, it might mean loss of libido or feeling physically numb during sex. And here's the cruel irony. Anxiety and depression already kill your sex drive. You take your medication to feel better, and it makes the problem worse. I've had patients in tears in my office saying, I finally don't feel anxious anymore, but now my marriage is falling apart because I can't be intimate. This isn't a minor side effect. This is a quality of life issue that can destroy relationships. Sexual dysfunction on Lexapro isn't just about serotonin. It's also about dopamine. Dopamine is your brain's motivation and reward chemical. It's what makes you want things, crave things, feel pleasure when you get them. High serotonin can suppress dopamine. That's why you might feel calm on Lexapro, but also unmotivated, flat, and completely uninterested in sex. Now let's talk about the side effect that blindsides people. Weight gain. Lexapro doesn't cause dramatic weight gain for everyone, but it can increase appetite, especially for carbs and sugar. It can slow your metabolism slightly, and over months or years, that could add up. I see this especially in adults over 40. You're already fighting metabolic changes from declining hormones, add a medication that increases cravings and slows metabolism. You can gain 10, 20, or even 30 pounds without changing your diet. One patient told me, I gained 25 pounds in a year. My doctor said it was just aging, but I stopped Lexapro and lost 15 pounds in 3 months without trying. This is despite what the research shows. Some studies show that weight gain associated with escitalopram appears modest and variable. When weight gain occurs, it tends to be small and develops gradually over months of treatment. Bupropion consistently shows the least weight gain among antidepressants and may be considered as an alternative when weight is a concern. Now here's another terrifying side effect of Lexapro: withdrawal. This is despite the fact that Lexapro has a relatively long half-life of about 27 to 32 hours. Paroxetine has a shorter half-life of about 21 hours, and venlafaxine has an even shorter half-life of about 5 hours. Fluoxetine has the longest half-life among SSRIs at 4 to 6 days. Escitalopram's 27 to 32 hour half-life places it in the intermediate to long range among commonly prescribed antidepressants. Despite this, the FDA still recommends gradual dose reduction when discontinuing escitalopram. This is because withdrawals can still occur with this medication if you stop taking it suddenly. You can experience dizziness, nausea, flu-like body aches, insomnia, irritability, crying spells. You may also experience what people call brain zaps. These feel like electrical shocks inside your skull. One woman described it to me like this: it felt like my brain was being rebooted over and over. I couldn't drive, I couldn't walk, I thought I was dying. This is called discontinuation syndrome, and it can last for weeks. Here's the mistake people make. They feel better after about 6 months on Lexapro. They think, great, I'm cured, I don't need this anymore. They stop cold turkey, and then they crash. The anxiety comes roaring back. The depression feels unbearable. Here's why this happens. Your brain adapted to having extra serotonin around 247. When you suddenly yank it away, your brain goes into shock. It has to recalibrate. That takes time. This doesn't mean you're addicted. It means your nervous system needs a slow, careful taper. I've helped dozens of people safely come off Lexapro. It takes weeks, sometimes months, but it's possible if you do it right. Now let me tell you what happened with Rachel. We didn't immediately stop her Lexapro. First, we had to understand why her anxiety got so bad in the first place. We checked her hormones. Estrogen was all over the place. Progesterone was tanking. Testosterone barely detectable. We looked at her sleep. She was waking up at 2:30 a.m. every night, her mind racing over work, her kids, her mother. We tested her vitamin D, red blood cell magnesium, and B12, all very low. So Lexapro was a band-aid on a bullet wound. So we started rebuilding her foundation. We added magnesium glycinate at night, omega-3s, vitamin D, methylated B vitamins. We worked on nervous system regulation, breath work, morning sunlight, cutting caffeine afternoon. We addressed the sleep with CBTI techniques and L-theanine. We got her into a regular exercise program and improved her nutrition. Within 2 months, she said, I feel more like myself. I'm sleeping through the night. I'm not snapping at people. She no longer wanted to be on Lexapro, so we tapered it down very slowly. It took 3 months. No brain zaps, no crash, no return of crippling anxiety. She's been off Lexapro for over a year now. She told me recently, I can feel again. I laugh with my kids. My husband and I are intimate again. I didn't realize how much I'd lost until I got it back. Now, Lexapro isn't a bad medication. For many people, it's a lifeline. If it's working for you without major side effects, that's incredible. But if you're feeling flat, numb, disconnected, or trapped, there are options. Talking about options, Zoloft is another SSRI that many have found helpful. Check out this video to find out if Zoloft is a better option for you.